Hello and welcome back to my channel. My name is Stacey, and on this channel I talk about stationery, journaling, planning, all of that fun stuff. I also add a sprinkling of study in there because I am a mature student studying with the Open University. And before we get into the video, I just want to say hello to everybody who's new, because I know that there are quite a few new people from my last video. So welcome, feel free to interact with the videos. It really helps to push my channel out to other people and helps me grow. And I want to thank everybody who did that on the last video. That I think was a huge part of why it was so successful. So thank you all so much to everybody who liked, commented, shared and hyped, because I know that's a new thing, is the hype button near the like button, I think it is. So thank you all so much, and feel free to hype again if you would like to. Okay, so just to let you know, this is the third time I'm recording this. I am having such an issue. The first time it was corrupted, the second time it was completely blurred. So third time's the charm. If I am looking down, it's because I have a script for this video, because it is quite involved and I don't want to mess anything up. It's quite important to get like names and things like that right. So I apologise if that is annoying. I'm trying to do everything from memory as much as I can. It's just not always that easy. Okay, so today I want to begin a series of videos on journal therapy. As some of you may know from previous videos, I took a course to become a qualified journal therapy coach at the beginning of the summer, I think it was. It was just before my husband became really ill and ended up in hospital. So through my videos here and on other platforms, I'm regularly asked how to journal, what to journal about, how do I start journaling, what's the point of journaling. I've also been asked about journal therapy itself, like I said, and also about mental health and well-being because of some videos I've created in the past. Probably the most asked question that I receive is, where do I start? And I intend this series to answer all of those questions basically, and more. Now I'm going to be providing you with a lot of information today, so I advise you to pause the video here, grab a hot drink or whatever, snack maybe, probably a notebook as well if you want to be able to remember some of the things, or I guess you can always just come back to the video, but yeah, a notebook may be helpful today. And get comfortable. Feel free to come back at another time if you don't have the capacity today to take in a lot of information. That's absolutely fine. This will likely be the most wordy of all the videos in the series because I want to give you a really clear foundation for the rest of the series. And as a thank you for watching, I've added a little freebie at the end of the video to thank you all for watching. Now, as some of my OG subscribers know, I'm a huge advocate of being trauma informed and of mental health in general, and that in part comes from my own circumstances, which I'm happy to talk about if anybody desperately wants to know the details. But the short version for the purpose of this video is that, like many of us, I grew up in an abusive household. I had 2 abusive parents and no protective factors, no protective influences in my life. So that has greatly impacted the trajectory of my life, including my physical and my mental health. And throughout my life, I've always journaled in one way or another, often picking it up and putting it down whenever I needed to. If I'm honest, it's when times were hard that I tended to pick up my journal, and I would often use a journal or writing to vent or work through something that was going on in my life. And you know, I've always loved the feel of a new notebook, the fresh, clean pages ready to hold my hopes and dreams, and like I said, my troubles and my hard times too. And while journaling is becoming increasingly popular by the day, I have found that it's still very misunderstood. For example, I mentioned in passing at a meeting at my son's school that I have been thinking about getting him back into journaling, and mostly that's because I know how useful journaling can be, especially when you're going through hard times. And my son certainly is. He's, you know, his dad has cancer and he can be struggling with that, and I wanted to give him a space to a safe space to put his thoughts and feelings down that he might not want to talk to me about, or teachers, things like that. And I mentioned that I was struggling to get him over the hurdle of just beginning. And to give you some context that the members of the meeting didn't have, my son has journaled ever since, well, I can remember, ever since he could make marks. You know, he would always have a little notebook and he would make marks, and then he would write and he would draw, and he had like sticker journals and stuff like that. So he's always journaled, perhaps not in the way of keeping a diary. Sometimes he has, but not, he's always journaled. But I was met immediately with comments like, well, journaling's hard and he might not want to write down all of his feelings, and that might be a lot to expect from him, and you know, it can be really intimidating to look at a blank page and all of those things. Now, I made a tiny effort to correct them at the time, just to explain that they seemed to have the wrong idea. But for those of you SEN parents who know, there are more important things to discuss in the meeting, and there's not always an awful lot of time to do so. So I just let it go. And to be clear, none of the people in that meeting said those comments with malice or with like poor faith. They just had a very rigid view of what journaling was, and many people have those misconceptions. It's not uncommon for that to be the case. And so if you are someone who shares those misconceptions but feels the urge to journal, feel free to follow along on this journey of ours, and you might find that you are a journaler after all, and you might even find that you've been journaling and you just don't know it. Okay, so what is journal therapy? Journal therapy, or writing therapy as it's also sometimes known, is a tool for self-exploration and personal development. It's defined as the use of handwritten, guided or free writing to promote well-being, self-knowledge, problem solving, and the actualization of each individual's potential. So that's according to the course that I took. For millennia, we as humans have used mark making, writing, drawing as a way to express ourselves, to record events, to make sense of experiences, of thoughts, of feelings, and to better understand ourselves. And in the 20th century, several schools of thought independently developed ideas that would lead to the emergence of journal therapy. Freud's psychoanalysis highlighted the importance of the unconscious and the liberating power of putting things into words. The humanist trend with Rogers and Maslow advocated for an environment of empathy and unconditional support and acceptance, and humans' ability to find our own way to self-actualization. And Simply Psychology defines self-actualization as, quote, reaching our fullest psychological potential, achieving deep fulfillment, and experiencing genuine satisfaction and meaning in life, end quote. And Ira Progoff, an American psychologist, developed the intensive journal method in the 1960s, which is quite similar to Julia Cameron's The Artist's Way, and it uses a structured approach to writing to promote personal and spiritual growth. And they're both here. We'll go through these in a bit. And then in the 80s, James Pennebaker, another American psychologist, took things further by demonstrating the therapeutic effects of expressive writing on both physical and psychological well-being. His research highlighted the benefits of expressive writing in reducing stress, strengthening the immune system, and healing trauma. So that's a lot of theories and information I just gave you, but it is important to know them because they are the foundation of journal therapy. And the combination of this and more are what provide us with an integrative approach. As a journal therapy coach, my job is to guide and support this process, and while this series is not a full service experience, I do hope that it's enlightening, useful and informative, and will help us all get the most out of our journaling experience. Okay, so moving on. The most convincing benefits that I have found, that I know of, come from James Pennebaker's study, Writing About Emotional Experiences as a Therapeutic Process. And this study found that those who wrote about their deepest thoughts and feelings about an extremely important emotional issue that's affected their life for 15 to 30 minutes a day for 3 consecutive days. And what this study found was that by asking the participants to write about their deepest thoughts and feelings about an extremely important emotional issue that was affecting their everyday lives for 15 to 30 minutes every day for 3 consecutive days, provided the participant with long-term improvements to both their physical and their mental health. And interestingly, this study also found that these results were predictable. So initially they asked humans to try to predict the outcomes. I think they found some kind of bias there, unconscious bias there. So they created a program called LIWC, which is Linguistic Inquiry and Word Count. And it was discovered that the words used were indicative of the health outcomes of the patients. So the more positive the emotion words the participant used, the more likely they were to have a positive outcome to their mental and physical health. The program also found that the participants who benefited most from the program were those who had quite disorganized, poor writing to begin with, and throughout the 3 days of this writing exercise. And the program also noted that the participants who benefited the most from this program were those who started out with quite disjointed, disorganized, poorly organized descriptions at the beginning, and who then progressed to clear writing by the end of the writing experiment. And from what they say in this study, to me it hints that they think that the process of getting better at writing is what provides the more positive outcome. But to me, I think this suggests that the progress that is being made through the writing, so the fact that they're writing about their emotions and getting it out, that is what can be seen in the writing itself. It's like the brain is organizing itself, and they can then come out with more organized, less disjointed writing. Let me know what you think. I'm not a psychologist, but that's what it suggests to me. Perhaps more importantly, Pennebaker's study has been peer-reviewed and built upon over the years, leading to more in-depth studies and more specific questions being asked. So, for example, we have Mindfulness as a Moderator in Expressive Writing by Alvin Poon and Sharon Danoff-Berg. I will try and link all of these in the description box, but I am aware that I got these from the library of my university, so some may not be available. But from what I know, if you contact the people who created the study, the authors of the study, quite often they're very happy to send out a copy. Okay, so Mindfulness as a Moderator in Expressive Writing by Alvin Poon and Sharon Danoff-Berg. So this study talks about how during Pennebaker's study, some of the participants experience more distress and psychological symptoms as a result of actually kind of reliving or rewriting, talking about it, going in more depth about these distressing incidents or emotional incidents. And what this study talks about is using mindfulness as a moderator for that. So the expressive writing itself can become a meditative experience, and that allows for a deeper connection to yourself and the present moment and things like that. And essentially what it finds is that individuals who had higher mindfulness scores did better with expressive writing than those with lower mindfulness scores. So if you were able to be mindful, then expressive writing was better for you than if you weren't, essentially. And then we have an experimental assessment of a Pennebaker writing intervention in primary insomnia. And so what they were talking about, primary insomnia being that it's the first time the participants are experiencing insomnia. And it found that using some of Pennebaker's writing interventions for people experiencing primary insomnia was actually very useful in helping to treat the insomnia. So another good study there. And then we have the efficacy of Pennebaker's expressive writing intervention in reducing psychiatric symptoms among patients with first-time cancer diagnosis, a randomized clinical trial. And like I say, because this has got a lot of authors, I'm just going to pop it all in the description box below. Essentially what this study talks about is that a cancer diagnosis in and of itself is traumatic, and that can lead to mental health problems all on its own. And what they found, without going into loads of detail because it's not a small document, essentially what they found was that Pennebaker's expressive writing interventions were effective in reducing the negative impact of cancer diagnosis on patients' mental health, which is the very short conclusion, but again, useful for patients dealing with something else that is causing mental health problems. And other findings have included benefits such as stress reduction, physical and mental health benefits like we talked about, strengthening of self-esteem and self-knowledge, boosting creativity, improving personal development, optimism, gratitude, and resilience. So that's what some of the ongoing studies and the peer reviews of Pennebaker's have found. And in case you're still thinking that this is all a bit new age and a bit woo-woo and the studies haven't convinced you, the NHS provide journaling sessions through some of their recovery college programs. So feel free to check those out. I'll link them in the description box below. But recovery college programs are essentially they're like courses, short courses for people to take that can help improve their mental health, their well-being, their physical health, and things like that. So I will link what I can below, so have a look at those and check those out. Journaling is not just about keeping a diary, it's a ritualized and ongoing practice. It's a space where judgment of ourselves is forbidden and curiosity of our inner self is encouraged. It's a space where we can free write, we can brain dump, we can explore painful and traumatic experiences, we can curate our creativity, describe our daily events and interactions, and moan about our partner or our mother-in-law, whatever takes your fancy. Most of all, it's a place to explore our most authentic self. It's important to know that there's no one specific way to journal correctly. There are many different techniques and practices, which means there really is something for everyone, in my opinion. From the morning pages by Julia Cameron to the Prog-Off intensive journal method and expressive writing, words that heal. That's by James Pennebaker, amongst many others, obviously. And methods such as learning journals, therapy journals, commonplacing, gratitude journals, the list goes on and on and on. The key is to find the one that suits you best at that moment in time and go with it. Lastly, for this episode in the series, I just want to leave you with a very important warning. Some journaling practices are not meant for everybody or should only be done under the guidance of a trained professional. For example, if you are an obsessive perfectionist, then introspective writing can make that worse. If you are prone to rumination, then writing long journal entries about past events is not going to be helpful for you. Please consider this when trying out journaling techniques and keep it in mind throughout the series. If you have a psychiatric condition or disorder, then please contact your GP or your psychiatric medical provider before beginning a new journaling technique, because some can make certain conditions worse without supervision. And that's it for this episode, my lovelies. Thank you all so much for sticking around if you made it this far. And if you did, then you're going to be rewarded with a free printable, which is a journaling therapy template. It's a daily page. It has different prompts to have like a mood check-in and thought snapshot and a cognitive reframe, things like that. So pop along to my website, which is linked in the description below, and it will be there on my website as a free printable for you. And you can use that as we work our way through the journal therapy series. I hope you found this episode interesting and helpful, and I look forward to seeing you in my next one, where we'll talk about some techniques next time. I'd love to hear your thoughts in the comments. Please feel free to let me know what you think and ask for anything that you want me to bring up in any of my episodes. And I'll see you all again next week. Thank you all again so much. If you could like, subscribe, share, hype, all of that stuff, it's so helpful. Thank you so much. Take care. Bye guys.